It's coming. 99% of people do not know it, but it is the baby face. And now you know. Like and subscribe if you've asked for this video. Thousands have. Or if you've watched more than one of my videos and I bring you value. I'll outline today the top 6 treatments to get it and what I saw in Korea. I'll detail it exactly for you today. I actually love it because it goes against everything we do and were taught years ago. Unless, of course, you follow me here on this channel. We've been doing this here for over 10 years. Now, you don't have to like all of what I'm going to show you today, but the concept is fantastic, and I guarantee you'll adopt some of it, if not a majority of what I'm going to tell you today. And spoiler alert, it all plays off of the precious fat layer you have right underneath your skin, right here. Look on this diagram, just under the skin and above the smaz. Yeah, the smaz you'll recognize from the facelift. You see, your natural fat, that layer just beneath the skin, well, you've been taught to destroy it, inflammaging with harsh skincare and harsh procedures. But that fat layer actually produces estrogen and natural hormones. So if you're over 40, it's even more important that you watch this video today. You see, it turns out what nobody tells you is that your adipose tissue, your fat tissue, is an endocrine organ. Adipose tissue, fat tissue, is no longer considered just a fat storage site. It's recognized as an endocrine organ that secretes various hormones, and hormones, as you know, equals what? Glow, lift, I call it gravity proofing, vibrance, smooth skin, and yes, that baby face. Let's get started. Your time is valuable, and to miss this video would be like asking your grandma how to use TikTok, only to find out she's gone viral for her anti-aging skin routine. It would be just plain silly. So in Korea, aging is optional. Many choose not to do it. I was just there for an extended time. Teens, well, they start anti-aging earlier than most Americans start SPF, sunscreen. And the goal, not snatched, but soft. Not cheek sculpted, not huge lip, not sexy, but baby. And you inherently know this. Why? Because in America we say the following terms. Soft as a baby's skin, skin like a newborn, smooth as a baby's bottom, baby soft skin, fresh-faced like a baby. You hear all of those. So why is the West still chasing angles and hollow cheeks, Texas jawlines? Before we get into how to do it, let's first look at a baby face before and after so you get an idea. First, I'm going to look at a younger patient with you. Later in the video, let's look at an older patient. Here's patient 1. Do you see anything? I put this picture up and I polled an audience of 500 injectors in the USA in Las Vegas last week. They did. They saw it, as they said plainly, they could see it, but you may not. See, these were a group of injectors I was lecturing to, and they know subtle. Why? Because constantly patients are coming into their clinic saying, hey, I don't see anything. I want my money back. I just don't see a difference. You see, the problem is 1 ml is 1 vial of filler, $600, think. And people come in getting 1 vial wanting it to do something. A teaspoon, therefore, is 5 vials. You see, we're taught to look at big differences like this. Big lips, big cheeks, big hair. So look at this picture. I'm going to come back to it, but do you see a difference? This is a baby face transformation in Korea. Once I show you the elderly picture at the end of this video, you'll then have a clear definition of what to look for. So one more look here. See anything? Note the timestamp below so when you need to come back to it, you can. On we go. So the baby face is the beauty ideal. Round cheeks, shortened mid-face, smooth skin, no harsh lines. It's not about looking young. It's about never looking like you aged at all. Here are the top 6 treatments to stay forever baby, and I'll outline what you have access to here in America as an alternative. Number 1, skin boosters. Think PDRN. Watch my Regeran video after this one. Then there's NCTF and exosomes. Now, you already know Reduran, the top salmon sperm product on the planet, and exosomes, I have many videos on, but you may not know NCTF. You see, it's a sterile injectable solution packed with vitamins, think A, B, C, E, amino acids, coenzymes, minerals, antioxidants, non-cross-linked hyaluronic acid, skin-boosting hyaluronic acid. Not the filler cross-linked, but non-cross-linked. Now, these all are injections across the entire face, not to fill, but to restore glow and elasticity and bounce. It's skincare with a syringe. Here's the picture of my face after getting them done. Well, what do you have widely available in Canada and the USA? Well, you have PRF, which has your natural exosomes, growth factors, and stem cells, including the entire secretome. Yup, PRF can be used in the exact same way, and of course it doesn't sting because it's all natural. There's no additives like heparin, sodium citrate, or prothrombin. It does take a simple blood draw, and it's only a 5-minute spin, so it's ready to inject in 10 minutes. Number 2, what about lips? They're ubiquitous in America. Everyone wants big lips. Well, Babyface is not that. It's cherry lips or gradient tinting. Here's a before and after so you get an idea. Think of cherry lips as a soft kiss you forgot you were waiting for. That's the concept. Instead of overlined glam lips, the Babyface's lips that look bitten, youthful, innocent, like you just had a lollipop. They're not overlined, they're not matte, they're not overfilled, or lipstick to the edges. They are often enhanced subtly with a touch of filler or a little bit of Botox for just a little lip flip. Think minor. Designed to look bitten, innocent, and kissable, not bold or sultry. Here's another before and after so you can see exactly what I'm talking about. The specific point changes, remember point changes. Think GK point. The vermilion border is just flipped up subtly. Many times, this is achieved simply with lip enhancers like this one, with peptides, lip plumping, and a little bit of tint with a timed release retinol to keep them looking like this over time. Number 3 is shrink. You probably haven't heard of this one, right? Shrink. It's Korean Ultherapy. Think of Ulthera and Thermage in the USA. Ulthera is ultrasound, Thermage is RF, like the NUA device. But Shrink is high-intensity ultrasound that lifts and tightens. HIFU, H-I-F-U, is very common in Korea, especially under the chin and under the eyes. It's like a mini facelift without looking done. It's subtle. You're now going to ask, Doc, why does Ulthera and Thermage often fail people in the USA? It's because people at age 60 are sold that it's a facelift. No. Results in a 60-year-old can be dramatic, maybe like 30% of the time, but 70% of the results are going to be subtle at that age. That's what they want under 50. But by 60 or 70, you often need more. And yes, you can face slim with it. You can remove fat or set it not to remove fat to tighten the skin. Remove fat or not remove fat, right? Well, it depends on the settings. What's that depend on? Your provider. And in Korea, they are expert providers. And we have a bunch in the USA too, but you want to make sure someone's using something like this all the time. Not once every few weeks, and you're not the guinea pig. Number 4, what about fillers? A lot of people say, does that have a role here? Yes, but not like you may think. In the United States, people are sold a faceful. Not so with Babyface. What most people don't realize is that we lose a tablespoon of volume from the face by the age of 40. A tablespoon is 15 ml, so people are told to get 15 syringes. Replace your fat with filler. Now you know the problem, right? What ages you? It's fat loss. But adding 15 mLs of filler is not replacing your fat, and thus you're not replacing the hormone factory that your subcutaneous fat is. And now you know why I've been harping on face fat and the importance of it and keeping it healthy for years. It's Babyface. And by the way, I know what you're thinking now, and yes, you are correct. You're going to say, does Ozempic, Wegovy, and the GLP-1 agonist drugs for weight loss, does that make people look older? Well, yeah, because it gets rid of facial fat. Just like over-exercising, just like not taking care of your protein when you're losing weight, and just like getting too much sun. Here's a stat I learned at a Congress in Vegas last month. Did you know that 25% of primary care practitioners are asked about getting on these drugs for their weight loss? A quarter of patients coming into clinics want them. So yes, that's why we get Ozempic face along with muscle loss. But if you do skin boosters, the treatment I talked about in number 1 that I told you earlier, then you only need a small amount of filler, and that's the trend. Fillers, therefore, are used, but just differently. What are the common areas? Well, I already said a tad in the lip, but also the forehead and the under eye is treated. Maybe a little in the cheekbone, just below the cheekbone to soften it, but just a little bit. Why fill the forehead? To make it a little more round and to blunt the angles and to keep it smooth. The goal? Soft contours, not sharp shadows. And yes, before you tell me the forehead, the veins communicate with the arteries and there's a high risk of blindness, I absolutely know that, but it's part of what's being done, so I'm reporting it to you. Same with the under eye and the temple. High risk of side effects there. Number 5, Korean sheet masks are huge. Think of sheet masks like a spa day stuffed into a single sachet. They are everywhere, as you see in this video from Olive & Young and this one from a 7-Eleven. Yeah, a 7-Eleven. Every store, no matter how big or small, has them, and often you'll find them in your hotel room as a gift, like you might find cotton swabs for your ears or a toothbrush for your teeth. An essential. Tell me this in comment below. Would you be offended to find sheet masks in your hotel room? Many people would. They say, if I was given a beauty device when I got to the hotel room, I'd be offended. What are they trying to insinuate? Well, I wasn't, because of how I looked getting off of that plane. Dry, crusty, and wrinkled. But comment below, how would you take that? Korean sheet masks are the instant hydration and the ultimate skin absorption of anti-inflammatory, hydrating, glow, chalk skin, glass skin ingredients. The top 3, avocado, that's going to be full of skin-loving lipids, rich in oleic acid and phytosterols. Snail mucin is a common one, contains glycoproteins, hyaluronic acid, and growth factors. And Simply Korean hydration ingredients is another one. I love the original one with Centella asiatica, hyaluronic acid, niacinamide. It just soothes inflammation and gives you that instant filter face. What we're going for here is that calm, dewy, even toned complexion, the baby face complexion. Number 6, and this is what I got asked the most last week at a Congress I was lecturing at. Do threads play a role here? Because threads seem to have dropped off. PDO threads, you guys call them, but there's other materials commonly used, PCL, polycaprolactone, and PLLA like Sculptra, poly-L-lactic acid. Those are also threads, so it's not just PDO, but with Babyface, they use PDO because they're a little shorter acting. Unlike what people in America want is permanent threads, not good. For Babyface, we're happy with the shorter acting threads because the collagen built by them is yours to keep because you take care of it. It's not scar tissue, but collagen. You see, if you get the Babyface concept, you get the long game. Results over time, subtle over time. That might be one of the most common questions I get asked in the United States. Is it permanent? Nothing is permanent. Everything, even a facelift, needs to be redone every 7 years. But as far as these threads go, think mini barbs, not the facelifting, jack me up heavy threads that many people want to use. Think here, multiple smooths, multiple twists, multiple barbed mini threads placed in non-dynamic vectors. That way there's low complications, and they're not sold as a facelift in a single session. What do I mean by non-dynamic areas? A lot of times we're taught in America to put the threads through the melolabial fold, the nasolabial fold, big heavy threads. And what happens is the threads start to poke through, or they migrate, or you get little irregularities, but they don't put them through those areas that move. The one area might be an exception would be the accordion lines here. There's not enough facial movement accordioning them, if I can say that, pushing them together to give you irregularities here. It's more the big folds in the face that you don't want to put threads through. Baby face threads don't go through those folds, so you just don't see the complications, and of course we love that. Now, what about Botox and toxins? Well, there's many toxins in different countries, not just Botox. But yes, in fact, when I was in Korea, I went to different toxin factories. Think Botox-style lip flips. Think jaw slimming, lowering that masseter angle. So getting rid of that Texas jawline. Forget vials of lip filler. Think subtle toxin lip flips. And then a drop or two of HA filler. You see, the jawline Botox, it shrinks that lower face for that V line. Also think microtox or baby Botox. Diluted and sprinkled across the face. No frozen forehead here. Botox used in that manner will tighten pores, reduce oil, and give the glassy, poreless finish. Many viewers of this channel, they don't realize that Botox can be dosed as such for glow as opposed to paralysis. You'll want to watch my baby Botox videos and my microtox videos. I give explanations, and those are in fact two very different types of treatments in and of themselves. Baby Botox versus micro Botox. Now, remember I told you I'd show you a before and after of an older baby face transformation. Here's that older face. You can see the changes now clearly. The shadows are gone from the under eyes, from the nasolabial folds, and from the marionettes down here. The jowl is gone, smoothed. The mid-face is shortened in effect by plumping the anterior cheek, not the high lateral cheek, which elongates the face. These are illusions that are created with filler, PRF, and biostimulators. Now, I want you to go back after the video and look at that original younger person before and after, and then compare the changes you're going to notice now, especially that shortened mid-face. While Western aesthetics are obsessed with volume and angles, the baby face is not. Don't add, don't sculpt, just protect the baby face you were born with. You'll now want to watch this video of my Korean street walk. You'll see some live action, a plethora of clinics, and I put a little spot of dining and nightlife in there as well. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.